I think what we need in the light of this report that we just did today is really focusing on making sure that there's universal access to family planning and other reproductive health services. That there's been good progress in Africa so far, but there are a lot of gaps as well. And the gaps are mainly concentrated in young people, adolescents, young women, who are not able to access and use family planning. So to really address this, there's need to improve access to information and services, youth-friendly services, but also focusing on the unique needs, especially of those young people who are not in schools, those who are marrying early, to make sure that there's more information and more services for them. One of the things I said in the meeting today, and that's covered a little bit in the report, is the whole issue about how Malawi's example of how they have improved family planning has really come with the narrowing of the inequalities, that the differences between rural, urban, the rich and the poor, and those who are well educated and those who are not that educated, is actually narrowing. And I think the big lesson for this has come from the fact that a lot of the success has been driven by very, very effective community-based programs where your health is being taken to the people as opposed to only getting people to come to health centers. And I think when you reach out in communities, you reach young people, you reach men, you reach women. You're not just focusing on women. You are likely to meet them as couples and so on. So I think it's the issue about really focusing on how do you address inequalities and removing the bottlenecks of access, many of which revolve around: are the men going to be going today to the hospitals, or are the poor least likely to travel? If you take services to where people live, you are going to achieve much more. I think for me, it's to recognize that things are changing in Africa. Governments are open now to making sure that the concept of universal access to sexual and reproductive health services is getting more and more entrenched. I think it's the right time for Europe to really come up and boost up the support. We know we want more ownership and more domestic resources to get into these services. But we should also recognize that now governments are recovering from COVID, the devastating socioeconomic impacts of health impacts of COVID. There are the impacts of the Ukraine war on commodity prices and so on. And African countries are still being hit hard by consequences of climate change. So the national budgets are tightening up. So even as we are sending the message, put more domestic resources, we need to know that the space has opened up now. More women are demanding family planning and governments are supportive, and it's the right time to come in and step up the gear so that by 2030 we can be as close as we can to the concept of universal access to family planning and other sexual and reproductive health services. So it's more support, it's opening up and making sure that the countries need more support, financial support, but also technical support.